discover what stores. Don't fear your road, unravel all.
Assalamu alaikum.
Wa alaikum salam. Doctor, how are you?
I'm fine, thank
How's
you.
everything?
I'm okay, fine, thank
Alhamdulillah.
you.
Please have a seat.
Thank you.
Alhamdulillah. Would you like me to pour some coffee?
Yes, please, yeah, I don't mind.
Tafadhal. So how are you,
Oh,
Doctor?
thank you very much.
It's been long since we last met.
Yes, that's right, that's right.
You remind me of the good old days in school. And every time I see you, I remember two things.
Okay,
I remember football, because we used to play together.
yes,
And I remember physiotherapy.
right, okay.
And these two things are linked. So tell me, what have you been doing in the past years after school?
Sure. When you said you reminded me of football, it doesn't click in my mind because I cannot remember seeing you playing football a lot, Harith.
I was collecting the balls outside.
But yeah, it's been many years now, and you know, it's been a pleasure meeting you as well. And interestingly, that you are linking me with the physiotherapy, which is my profession. I'm glad to hear that as well.
Alhamdulillah,
I'm
alhamdulillah,
glad to hear that,
alhamdulillah.
yeah.
So, how does it feel to be in the profession of physiotherapy?
Well, physiotherapy as a definition, and I would like to define it because there is a lot of confusion going on about my profession.
Yes.
And I think this is an opportunity for me to explain or define what it is, because actually a lot of people are confusing it with a massage therapy, with exercise therapy, manipulation therapy. So I think this is a good opportunity, and I thank you for inviting me to talk about it actually. So physiotherapy as a profession is a science-based profession that assesses and diagnoses and treats a wide range of different conditions really. So if we take an example of neurological conditions,
Yes.
and I can give an example of a stroke, for example. That's where the blood supply is blocked, or there is a rupture in the blood vessels going to the brain.
Yes.
And these kind of people tend to suffer from coordination and balance issues when they walk, for example, after the hit of the stroke. They also develop muscle weakness, and they lose the normal range of movement. Suppose, you know, they cannot move, for example, they cannot move their elbow fully.
Yes.
So our job is to assess what is the current situation after the disease, and to really advise what is the right exercise that we can give, a rehabilitation program that we can give to these people in order to normalize their movement and in order to get them back to normal lifestyle, if you see what I mean. So that's one line, neurological. Yes. We also have a very big discipline in physiotherapy, which is called musculoskeletal condition. And that's my line of interest.
Normally,
actually.
you guys, when you speak in medical terminologies, I just get lost.
You get lost, okay. And I will try to simplify it as much as possible for you, Hatim. So musculoskeletal is basically if you have injuries in your muscles, in your bones, that's where you can come to me.
Okay.
So, you know, I'll give you an example. Sports injuries is my specialty.
Which is very common for young people.
For that matter, yeah, that's right, that's right. So those who are getting injured in their knee, in their ankle, so the first thing they need to do is to see physiotherapists and assess the damage which is there. It could be a ligament damage, a meniscus damage. So it is our role really to treat them using different type of physiotherapy machines, which helps to recover and speed up the recovery. And after you minimize the pain and the swelling which is associated to the injury, then we gradually take them back to do the exercise in a very safe way. That's how we do it.
I don't know why I always associated physiotherapy with doing it manually, using your hands.
Yeah.
But I once also was treated by a physiotherapist, and they used equipment.
That's right, yeah. That's right.
So I don't know why there is this misconception among people that physiotherapy is about, you know, manually repairing things.
Manual techniques is a big part of physiotherapy. There is no doubt about that, and I think we are proud to say it that loudly, because that's what differs us from differentiate physiotherapy from other professions as well. So the concept behind manual therapy is really, we tend to believe, for example, if we take the spine,
Yes.
the neck and back and everything, the people who are suffering from neck pain and back pain, we tend to believe the problem is the malalignment,
Yes.
which is, it is not straight. Your spine is not straight. There is a deviation. There is a kind of, shifting towards the right side or left side of your
Yes.
spine. And manual therapy can help you to bring back this alignment or straight spine that is being affected through bad posture, for example, and as you know, Hatim, how many hours we spend in sitting position.
In front of a desk.
In front of a desk. Interestingly, that there is a lot of studies suggesting that an average person nowadays
Yes.
spends about 15 hours in sitting position. And that's not just not acceptable, really.
I'll tell you something very funny.
Yeah.
I don't know why, when we were in school, I always saw you like an engineer.
Okay.
That you turned up to be an engineer.
Right,
But
okay.
you disappointed me. You turned up to be a physiotherapist.
I'm still an engineer for human beings.
So tell me, how did you come into the decision that you want to get into this profession? Did
Right.
anyone influence you? It was your own decision? You knew about it from the beginning? Or
Right.
that was the only opportunity available at that time?
It's again, this is a funny thing to talk about as well, because I remember those days, a lot of us graduating from school, not knowing really what you want to pursue your life in,
Yes.
as a career. And at that time, there was a lot of opportunities to get sponsorship and study outside Oman.
Yes.
And I thought, why? Why not? Let me try and go outside Oman, explore the world and experience something different.
Yes.
Not putting in my mind what specialty really would be the
Suitable
best
for you.
the best for me. And therefore, I applied for several, opportunities. There was an announcement for veterinary, for example.
Yes.
And I was not successful to go for that one. There was an announcement on accountancy, and then there was an announcement on physiotherapy.
Thank God you didn't go for accountancy. You would end up like me. This is an accountant.
Which is a good profession, no doubt at all. So that's how it turns out to be. And I said, why not? Let me go and explore this
Yeah.
new profession. And I knew that time we don't have a lot of Omanis who are specialized in this one.
Yeah.
And I thought it will be close to my heart as well,
Yes.
being a person who has a lot of passion in football.
Yes.
And physiotherapy is involved in sports injuries and all that kind of things. And after all, the first year when I was studying in the UK, I thought it was a terrible year. But later on, you come and realize that no, you always remind yourself of the saying of the Prophet Muhammad sallallahu alaihi wasallam, when he said, God loves those who are doing their job with perfection.
Yes.
And this is your fate, this is your destination, you are going to be a physiotherapist. So let me put my whole effort
In it.
And be 100% good physiotherapist for that matter.
Dr. Abdulhameed, there is a fear among people in professions that are related with medicine.
Right.
And the fear is that I have to go through the entire cycle of the medical school,
Right.
like 6 years or 7 years, and
That's
then
right.
I switch to physiotherapy or other things,
Right.
which is a misconception.
Yeah.
Can you clarify that, please? Did you have to go through the entire cycle of medical school?
No,
or is
no.
it a total different
No,
area?
it is a totally different discipline in the medical field, Hatim. So what we share with the medical doctors, for example, is that we both study things like anatomy. That's the the structure of your body. We study physiology, and we study diseases and illnesses. We cover all those things. However, what is the major difference between the two disciplines is that they go in depth about pharmacology. That is the medicine and the tablets
Chinese
that
now.
we're using. Exactly. That is the medicine and the
Yeah.
tablets they're using. I cannot prescribe you Panadol or, you know,
Okay.
muscle relaxant and that
So
kind of
you
thing.
you only use the equipment or the exercises or manually, but you don't prescribe medication.
We don't prescribe medication.
Okay.
The other thing which is really important in the profession of physiotherapy is to look after the psychological state of your patient.
Yes.
And I think it's very important for me to clarify that one as well, Hatim. So, for instance, I get a lot of people who are complaining from neck pain, for example.
Yes.
And neck pain, from my own experience, is very much stress-related condition. So
Okay, now I get you when you said psychologically, because I was wondering, what does psychology have to do with physiotherapy?
that's right, that's
Yeah.
right, that's right. So, you know, there are times where the best treatment for these people who are having neck pain because of the stress work they have in their workplace is to listen to them. You know, there isn't much that you can do. And believe me, sometimes they don't have that opportunity to have someone that they can listen to them very well. So, you know, you have to put in mind when you treat any condition that, you know, you are taking psychological side of this patient.
So don't tell me
very
you
much.
you have a sofa in your office for the patients to come and lie down and tell you their
No,
life
but
story.
we have bed that that is very comfortable for them. That and they tend to chat with us about
You
it.
have amazing equipment in the physiotherapy room.
That's
I
right.
see some items like sports items. Some of them look like toys. They are colorful. And normally when you enter there, you say, okay, I wonder how this works. I wonder how this works.
That's right. Yeah. That's
But
right.
I think you get to bond with the patient. You get to talk to them.
That's right.
And you spend time with them as well.
That's right. That's right. Yeah.
And let me tell you a story of a physiotherapist that
Okay.
I went through. That after Allah
Was that
subhanahu
in
wa ta'ala,
Oman?
in Oman, she actually changed my life.
Okay.
As I used to work as a mechanic.
Now I'm very
And I
proud
got,
of myself.
really, honestly, this is a true story. I went to play football again, football.
Okay.
And God knows how, I broke both my knees. I got injured.
Right.
So I had to go for 3 months of physiotherapy. And there was this old English woman
Okay.
in the hospital who used to do the physiotherapy for me. So she told me one day, you look like a very smart guy. You're very young. Why don't you pursue your further studies? Why are you working as a mechanic?
Right.
And day after day, she started, convincing me
Right.
of go and study, go and continue, look
Okay.
for a career.
Sure.
And subhanallah, I listened to her advice,
Sure.
and here I am today. Yeah. So
Subhanallah.
thank you all physiotherapists out there.
Well, that's very nice to hear. That's very nice.
So
to
I
hear.
think the human part of the treatment, where you listen to them, where you can even advise them
Sure.
or guide them, that plays a
Sure.
huge role.
Sure. And I was lucky enough, Hatim, when I was working in Royal Hospital back from in the period between 1998 to 2007, I was on and off involved with the national team of Oman, the football national team. They approached me and I said, why not? This is another opportunity
Yes.
to...
And you love football.
And I love football. And
Yes.
this is why I said, it must have been the,
So
the,
did
the
you
right...
get the front seat at the stadium or on the pitch?
There was a time when the coach, we had a New Zealand coach at that time, who asked me to practice with the
them.
boys.
Yes.
And after the practice, he came to me. He said, "Why don't you be on the bench one day when I have all my players injured and everything?"
Yeah, you can join the team instead of being a physiotherapist.
Exactly. But the point is, I was trying to mention to you is, since you are talking about the psychological side, I remember that time when I was traveling with the national team.
Yes.
I was the only person representing the medical team. So I didn't have a medical doctor with me. I didn't have a sports nutritionist. I didn't have a sports psychologist who are all very important
For the team.
aspect for preparing the team.
Yes.
So at that time I was just trying my best to learn about these professions and help out the team. Maybe something will help in the preparation and getting them better results, if you know what I mean. And one of the things I was really interested in is studying about sports psychology. And it is still something that I practice on daily basis with my patients as well. So things like visualization, and it is something that we do every day, Hatim. For example, to give a simple example is me, before coming here today, I was visualizing
What's going to happen.
what is going to happen and how to prepare myself for this interview, for example. And I guess the same thing with you. Maybe now it's becoming like a routine, but when you started, maybe it is something that you used to do, is to visualize,
I think I still do it.
Right.
At the back of my mind, I still do it.
Okay.
Because,
but with more practice, it's sort of becoming subconscious thing that is in your mind, isn't it?
Absolutely.
Yeah.
Dr. Abdulhameed, you went further in your profession. You wanted to know more, and you went and you did your PhD.
That's right, yeah.
What drove you to take this decision to continue with your further studies and become
I think
a doctor in this
yeah. I think the biggest objective I had in my mind before going for PhD in my profession is to widen up the scope of my practice as well.
Yes.
So when I did my PhD, it was not only primarily physiotherapy thing, really. I involved other specialties, subspecialties with it as well. So, there was an element of sports and exercise science with it.
Yes.
There was an element of sports psychology in it as well. And another thing I added up in my research for PhD was to look at the genes of players. Because interesting enough that I was reading before going for my PhD that there are certain genes that you possess as a person can help you to be a better athlete or a better sports person, if you know what I mean. So I thought, why not to go and study about that? Because end of the day, I will come to Oman, and it is something that we want to work on to improve the performance of our athletes. At the moment, we
want our team to be leading.
That's right. So sometimes it happens that you spend or you waste time with young athletes who might not get to the peak level of being athletes.
Yes.
So if you look at their genes, for example, in a very young age, it might save you time to think that, okay, maybe he might be potential and we can pursue further with him and focus on these particular athletes, for example.
Dr. Abdulhameed, recently I've noticed that many young people are suffering from disc problems.
That's right, yeah.
And knee injuries, especially the guys who are playing football.
Sure.
How can we'll start with the knees first. How can we protect our knees?
Okay.
And what are the things that can cause the damage to our knees?
Sure.
Because we have a large number of people who have knee injuries.
Okay. I'm really happy, Hatim, that you asked me that question, because I almost forgot to cover that one.
Yes.
So to talk about the knee injuries in particular, as well as other joints in your body, but in particular knee, which is very common injury here in Oman, to an extent that you cannot believe, honestly. And I feel sorry for seeing a lot of our young athletes having to go to surgery or operations because of something that can be prevented. And I think it is a role of physiotherapy, and this is one of the things that I'm trying to really work hard on, is to visit clubs, to visit schools sometimes, educate physical education teachers in schools about the importance of prevention.
Yes.
Because believe me or not, when you talk about knee injuries, about 70% of knee injuries can be prevented.
Subhanallah.
Yeah.
Subhanallah.
And it is to do with getting involved, doing the right exercises. So a lot of our athletes or footballers in Oman, they don't focus on balance and coordination exercises. A simple example I can give you is if you ask a footballer to stand on one leg and then sort of putting their hands wide apart and then close their eyes, you will be amazed that they cannot survive for few seconds only
Subhanallah.
standing in that one leg. So that is telling you the full story, that they need to focus on exercise that looks after the coordination and balance of these athletes. And this is what they do in the Western world, for example. Big clubs like Real Madrid, Barcelona, they have fitness trainers who are specialized to look after this aspect of balance and coordination.
So that they don't get into the injury.
Exactly, exactly. And I can confidently say that that is the biggest issue. Plus, adding to that, the issue of muscle balance.
Yes.
So, for example, if we are talking about the knee, you have the thigh muscles front and back.
And back.
There is a ratio between these two muscles. Do you have the right ratio or not? You know, there is a ratio also between the right side and left side of your thighs as well. If you're losing that normal ratio, you are prone or you are more likely to have injury as opposed to someone else who is having the right injury.
And normally, Dr. Abdulhameed, especially young people, they're very naive when they go and exercise. They just do it to get like bigger thighs, or bigger arms, or bigger chest.
Yeah, that's right.
But they don't look in the aspect that, am I doing it the right way?
That's right, yeah.
Is this the right size for my body or not?
They miss the guidance sometimes. You know, another example is Hatim, maybe you might have heard how many of our youngsters who are starting, you know, fitness training, and they will start using the proteins.
That's right.
You might have heard that.
Yes.
Now, that one might be good for someone who is serious in bodybuilding and weightlifting, but not for someone who is going regularly to the gym to do fitness training twice a week, for example. That's no good for them. And I think your point is leading me to talk about you know, the importance of physical fitness, Hatim, which is I consider as a big threat to the population of Oman, if not the whole world really. Obesity and overweight is becoming very epidemic, the norm, unfortunately. And I think that's another thing, me working in the Ministry of Sports, to be responsible about educating and getting people aware about the importance of physical activity.
Yes.
You know, you are
and threats of obesity, diabetics, and so on.
Exactly. And it's very nice to see World Health Organization, WHO, has put a lot of nice, easy, and simple recommendations for people to follow. You know. So now it is very well known that if you get yourself engaged in a physical activity for only 150 minutes per week, then you are very much safe from developing diseases which can be preventable. And I'm talking about, you know, diabetes, for example, blood pressure, and all these, and obesity itself. You know, if you commit yourself doing exercise 150 minutes per week, you are far away from you know, being in having the risk factor of.
I was about to welcome you for a croissant, but I changed my mind.
I will have a coffee. I don't mind.
Now, Dr. Abdulhameed, for the people, the young people who want to get into the profession of physiotherapy, what is the advice that you can give them now that you have gone through the entire cycle?
One of the biggest advice I would say is be fit, be physically fit, because this job requires a lot of there is a lot of physical demand with it. You know, unless you don't want to do the profession in the perfect way. Honestly, you know, if you want to see a patient with a disc problem, for example, there is a lot of pulling of leg. There is
Yes.
a lot of pulling in the lower back area.
So
as
if,
well,
if you're not physically fit yourself, then
exactly, exactly.
you have
There is
trouble.
a lot of pressure going into the spine itself that helps to gain or bring the normal position of these joints back again. And you know, how can you prescribe an exercise to someone and he will sort of looking at you and say, you know,
What are you talking about?
what are you talking
What are you
about?
talking-
Exactly. So you need to be an example.
Yes.
You need to set an example. But I think the job itself, to be done in a perfect way, you have to be physically fit. You have to be physically. Plus, of course, you know, like any other job, you need to have the passion. You know, do you really like this kind of job? Do you want to help people who are suffering from neck and back pain? Do you want to help people? Because another discipline of physiotherapy is we are looking after pediatrics, which are children as well.
Yes.
You know, who are born with the diseases like cerebral palsy and other diseases as well.
Yeah.
Do you enjoy that? So you need to ask yourself those questions before.
Yes.
Uh,
And I think now the options are more for people to find out about professions and to ask
Yeah, yeah.
people
Not like
such as
our
yourself.
days, not like
yeah,
our-
nowadays it was just whatever comes in front of you, then
Exactly,
you
exactly.
grab the opportunity.
Internet can tell you everything
Yes,
about this
yes,
job
you're absolutely right.
in videos as well.
Thank you very much, Dr. Abdulhameed. I really enjoyed it. I was sitting alone and you joined me. You must be a very busy person, but thank you so much for being with me. And I hope to see you soon. Let us play football one day, inshallah.
Yes. It's my pleasure being here with you, Hatim. And I'm really happy that you have invited me in this very nice environment. I almost felt relaxed straight away sitting down here
Alhamdulillah.
after the session. Thank you.
Shukran, Doctor. Thank you so much.
Thank you.
Thank you.
Bye.
Your mountain fright. Go for your light. Just make it bright. No matter how might your mountain fright. The road is yours. Uncover what stores. Don't fear your road. Unravel all odds. The future is yours to draw the short. If you